Excellent afternoon, everyone. Excellent afternoon, everyone. We are welcome to this afternoon's broadcast. Happy New Week to every one of us. We thank God for a wonderful week He has brought us to. Welcome to Aging with Grace. So today we are handling, the topic like we advertised, understanding blood pressure reading, and then we are going to be treating this by answering 10 questions you should know the answers to. 10 questions you should know the answers to. So as we answer these 10 questions, you will understand, your blood pressure, the readings, and what you're supposed to do, how you're supposed to handle them. So you're welcome. I want to especially thank every one of us that bought my book on Healthy Heart Guidebook. As we can see, it's an ebook that is downloadable. Thank you all. We launched it last week, and a lot of us already bought the book. I'm very, very grateful to every one of us that bought it. The book is still available for those who want to buy. You can DM me. You can just say Healthy Heart Book, and then I'll be chatting you privately. The book actually is 4,000 naira, but again today there will be some little discount, not as much as on the launch day. There will be a little discount on the book. So go ahead and chat on the comment section. You can also ask your questions on the comment section and make your comments also on the comment questions. So the first question to understand, your blood pressure reading and understand its implication is, what does blood pressure tell you? What does your blood pressure tell you? So, your blood pressure measures the force of your blood pushing against the walls of the your arteries or the blood vessels. So your heart pumps blood into your arteries, and the arteries carry that blood to the rest of your body. So when your doctors, or your nurses take your blood pressure, is expressed in two measurements, two numbers. The first one that is on top, and then the second one that is under. The first one on top is called the systolic, and the one under is called the diastolic. It's like a fraction, like 120 over 80. That's how it's measured, All right, so then the top number of your blood pressure reading tells you the force of the blood against the artery walls when your heart is beating. So that top number measures, the pressure when your heart is beating, and like I said, it's called the systolic. But the one under, measures, the blood pressure when your heart is at rest. That's between heartbeats, and that's called the diastolic pressure. Both numbers are important in determining the state of your heart health. When numbers are greater than the ideal range, it indicates that your heart is working too hard to pump the blood to the rest of the body, that your heart is actually overworking. And that's why you find out that some people, their hearts are older than their real age, that their number age, So that's, the first question we need to answer there. Then the second question is, how do you know your blood pressure? What do you do? How do you know your blood pressure? Because some people might not even know. Well, you get to the hospital, and then anytime you go to the hospital, for those who go to the hospital, you find out that one of the first things, routine things they will do for you is to take your blood pressure. So most clinics, in fact, every clinic should have the sphygmometer that is used in measuring the blood pressure. So, and then some people also have sphygms at home that they buy and keep at home to measure blood pressure. So we'll be discussing more about this. If you're at certain age, you need to actually visit the clinic, even if you're not sick, just to take your blood pressure, or you can get the sphygm at home and keep it so that you can take your blood pressure from time to time. All right, so what numbers, question number 3, what numbers mean high blood pressure, and what numbers mean lower or normal blood pressure? So normal blood pressure is actually at or under 120 over 80. It should be at or under it. That's how you know you have normal blood pressure. In November 2017, the blood pressure guidelines were modified, and any blood pressure measurement at or above 130/80 is now considered as high blood pressure, and that's what the medical communities call hypertension now. So it has to be below 120/80 or at 120/80 before they say your blood pressure is normal. Then what are the different if you're looking at blood pressure, you're looking at what are the different blood pressure categories. Blood pressure can be categorized into 5 different types. You know, your blood pressure can be categorized into 5 different types. You have the normal, which is the blood pressure, like I've said, between 120/80, and it's considered to be normal. When your blood pressure is between 120/80 or under, it's considered to be normal. And then they have the elevated blood pressure, and that's when the blood pressure reading consistently ranges between 120 and 129 systolic. That's the upper one, reads like between 120 to 129, and then less than 80 for the diastolic. Then it is now known as an elevated blood pressure. People with elevated blood pressure are at risk of high blood pressure unless steps are taken to control them. Then now the third stage is the stage that we call the hypertension stage 1. And in this condition, blood pressure reading consistently range from 130 to 139. The systolic, the upper one, will range between 130 and 139, or the lower one will now be reading 80 and above to 89. You know, that's when the doctors now prescribe blood pressure medications, and then of course some lifestyle changes to reduce the risk of heart diseases and also strokes. Then you have the fourth one, which is the hypertension stage 2. And in this condition, the blood pressure reading consistently ranges from 140/90 and higher. Immediately that upper one hits 140 and higher, or 90 and higher, the doctors will definitely prescribe a combination of medication and also lifestyle changes. That's when the person is said to be on the hypertension stage 2. Then the last stage now is the hypertensive crisis. That is the fourth stage, the hypertensive crisis, and this is the most critical condition, and it requires emergency immediately. You know, in this condition, the blood pressure suddenly exceeds 180, the upper systolic exceeds 180, and then the lower diastolic is about now, you know, reaches up to 120. And you know that at that stage the person should actually rush to the hospital. And you know, at this stage of hypertensive crisis, the person will begin to have some symptoms like shortness of breath, they will have chest pain, they will have back pain. Sometimes they will have some numbness and weakness in certain parts of their body, especially maybe one-sided. Maybe they will say their arms or their legs, they are having numbness there. And then they will have change of vision. They won't be able to see well. And sometimes some people have difficulties talking at this stage of hypertensive crisis. So these are the 5 stages that I was saying we'll look about, the different categories of blood pressure. Remember, I said the normal, you have the first one, the normal, the second one is the elevated, the third one is the hypertensive stage 1, the fourth one is the hypertension stage 2, and then the fifth one is the hypertensive crisis. So what is normal blood pressure according to age? We need to look at the age. I'll just read it very briefly for us, you know, very fast, and then maybe by tomorrow I'm going to be dropping a post with the table on my page so that you can go back and look at it if you want. But we'll just briefly run through what normal blood pressure is according to people's ages. So we will just run through it now. Blood pressure according to stages. All right, so I'm going to be reading a chart that talks about the normal blood pressure according to age, both for male and both for female, the diastolic blood pressure and the systolic blood pressure, in the chart. So like for the male, if the age is 21 to 25 years, it should be between 120.5. I'm talking about the higher range now. That's the higher range. 120.5 over 78.5. Between 21 and 25 years old. Then if the person is 26 to 30 years old, it should be like 119.5 to 76.5. 31 to 35, 104.5 to 75.5. 36 to 40, 120.5 over 75.5. Maybe 41 to 45, 115.5 over 78.5. 46 to 50, 119 over 0.5 over 80. 51 to 55, they expect maybe by then, the people, one is getting older, 125.5 over 80.5. That's when it now hits, that other side. Then 56 years old to 60 years old, 129.5 over 79.5. 61 to 65, 143.5 over 76.5. That's for male. And then for females, then when they are 21 years to 25 years old, 115.5 over 70. 26 to 30, 113.5 over 71. 31 to 35, 110.5, 110.5 over 72.5. 36 to 40, 112.5 over 74.5. 41 to 45, 116.5 over 73. 46 to 50 years old, 124 over 78. 51 to 55 years old, 122.5 over 74.5. Then 56 to 60 years old, 132.5 over 78. 61 to 65, 130.5 over 77. Anyway, this is just what a chart can tell you on blood pressure. But of course, as we go on, you find out that there are ranges, certain things that can make it to go up, and what you're supposed to do if those things happen to make them to go up. So now the sixth question is, what causes high blood pressure? What actually would make one to have high blood pressure? Well, high blood pressure is something seen in patients of all ages, and it's often linked to sedentary life, inactivity, like I always say, which is not good. When somebody is inactive, when somebody is sedentary, it can cause high blood pressure. Poor diet is another thing that can cause high blood pressure. And then when somebody is overweight or obese, it can also cause high blood pressure. Then some people have the family history of high blood pressure is another thing that would make it. If you have the history in your family that people are having high blood pressure, then that means you need to watch it, because it's an indication that you too might have blood pressure, like genetics. And then age, like if you notice when I was reading the pressure, the normal blood pressure for the different ages, you find out that as I was going upper, even for the male and the female, the pressure was increasing, the high blood pressure reading was increasing. So age is another thing that can make the blood pressure to go up. And also ethnicity. The ethnic group you belong to can also play a role. And you know why this is? Why it happens is that you find out that people from some certain tribes, they eat some kind of food. There are some food that are found that they are always eating. So, and then they have a kind of general same lifestyle. So this lifestyle also for the tribe is also one of the factors that make, you know, some people to have blood pressure. And then another thing that is very important that we need to watch is drugs, the medications that we are taking. Some medications can also spike someone's blood pressure, and that's why it's good for you to, if you're taking medications, to keep checking your blood pressure. And then if you notice there's a spike on your blood pressure, then you need to discuss it with your doctor or whoever that gave you such medications. Okay, so we've answered question 1 to 6. You can ask your question. Welcome everyone. You would have noticed that this is a premiere, but I'm here with you live. I'll be answering your questions, you know, when it's being played. So you can just type in your questions and I will answer your question. And like I said, if you need my book on Healthy Heart Guidebook, you can just put Healthy Heart Book and then I'll chat you privately, or you can just chat me on WhatsApp on my number 0703-515-1642 so that you can get your downloadable Healthy Heart Book, Healthy Heart Guidebook. It's a fantastic book, very colorful, and it has 11 chapters, and it tells you most of the things you need to know concerning your heart health. All right, so what does blood pressure, what does blood pressure feel like? High blood pressure often does not have any symptoms, so you don't usually feel it. It doesn't have symptoms, and that's why sometimes you find out they will say, hey, this person is very, very healthy. Nothing is, no, he just did this yesterday. He did that yesterday. And then the person gets to the hospital and then the reading is so high. I remember somebody was saying that he was just feeling funny somehow. You know, he just suddenly started feeling funny. And he just said, let him get to the hospital. He went to the clinic and they found out that, you know, his blood pressure reading had gone to the elevated, even higher than the elevated. In fact, it was a crisis moment. They had to just you know, keep him back in the hospital and admitted him. So it's very, very important that you check your blood pressure at certain age. For the younger people, anyway, we're going to be looking at that when we look at some of the things we need to do. So question number 7 says, what does high blood pressure feel like? And I'm telling you, you don't feel anything, because hypertension is usually actually diagnosed by the healthcare professionals, maybe the nurses or the doctors, when you go for checkup or when you have an issue and you need to get to the hospital. The average person then that is not hypertensive or that should now go and get your blood pressure reading once a year. If you're very healthy, you're young, maybe between the age of 25 to 40, you're young, you're very healthy, don't just take things for granted. At least once a year, go and do your overall check, especially you know, trying to check your blood pressure, your blood sugar and cholesterol and the rest once a year. But it's important that everyone needs to know their blood pressure reading. Once you're up to 25 years old, you can go once a year. And you know, when you get to know your blood pressure reading, you also check your blood sugar, also check your cholesterol, and also your BMI, your body mass index. You need to know these numbers so that you will be able to know if you need to start doing some more things, you know, concerning your health on time. It's always good to know and get to do things on time. Remember, prevention, I always say, is better, it's cheaper, it's smarter, it's healthier than cure. So start on time. Blood pressure is even more important to pay attention to if you have a close relative with hypertension or other risk factors. Like I said before, what are the causes? We have handled that, and we talked about poor diet. We talked about maybe taking drugs. We talked about genetics. We also talked about, you know, if you have a relative that has been hypertensive, like if your parents or any of your siblings is found to be hypertensive, your older ones, then if you're younger, you need to actually be sure and you watch out for it. And you know, if the blood pressure is extremely high, You may have unusual headaches. That's how it happens to some people, but that's when it gets unusually high. When it's high, some people don't even notice it. You don't have any feeling, you don't even feel it, and that's why people just slump. They will say, hey, this person just slumped, oh, nothing was happening to him, oh, you know, he won't even know. Like I had a story of a guy that was 40 years old, and he slumped and died, and they said it was, you know, a blood pressure issue, that he had heart attack. And he was so young, he was agile, he was moving everywhere, but he hadn't even checked his blood pressure. He wasn't even considering that, because to him, he wasn't having any feeling. Any sickness that does not have symptoms is very, very deadly. Why is it deadly? Because the person will be deteriorating, the person will not know. So, and that's why it's always good for one to have checkups. And thank God we have clinics all around us. Go check your blood pressure reading and get to know your blood pressure reading. So when the blood pressure is extremely high, some people will have headaches, some people will have chest pain, some will have difficulty in breathing, and they get easily worn out when they do a little activity or exercises. They just get tired. They find out that they are easily tired. And if you're having any of these symptoms, it's good that you consult, go to your hospital, and let them do a real check-up for you. Then question number 8, can someone die from high blood pressure? High blood pressure, if it's left untreated, it can actually be very, very dangerous. And that's why it's important that you make sure you handle your blood pressure, because it can force your heart to work harder and to get blood out of the rest of your body. You know, it forces your heart to work harder to get blood all over your body when your blood pressure, if it's untreated. All right, and it can also lead to a number of serious and potentially deadly conditions if you allow blood pressure to, if somebody stays, you know, having blood pressure for a long time. It can actually lead to some deadly conditions like the hardening of the arteries. It can lead to stroke, and of course, you know, if somebody has stroke, a lot of people with stroke, they end up dying of strokes. It can also lead to someone having some kind of kidney diseases. High blood pressure can lead to kidney failure. It can lead to other forms of kidney diseases, and then it can also, of course, lead to heart failure. High blood pressure, if left untreated, can lead to heart failure. And then blood pressure also can cause heart attack, stroke, heart failures, like I said, vision loss, kidney failures. All these are some of the things that high blood pressure can actually cause. All right, so number 9, the 9th question, what are the ways that we can lower blood pressure for people who have high blood pressure? Well, the best treatment for high blood pressure is diet. That's the first. Diet, then secondly, exercise, and then thirdly, lifestyle changes. This book I talked about handles this. It handles your diet. This book has the diet that can help you have a healthier heart. It has some recipes of food that are meant for people with high blood pressure in a chapter. It also has weekly menu that you can take if you're having high blood pressure. This book also has it. It also has some exercises advice that you can have if you're having high blood pressure. And then it also talked about some lifestyle changes that you need to, you know, embark on if you're having high blood pressure. Like I said before, it's an 11 chapter book, 91 pages, and it's it's a book you should have beside you. So you can put Healthy Heart book on the comment section, and I'll be chatting with you on how you can get this all so important book that we all need. All right, so when it comes to lowering your blood pressure through diet, you can start by making small changes like avoiding high sodium food or swapping, you know, your daily snacks, all these unhealthy snacks that you eat. You just pop up flour-filled snacks all around because you're hungry and eat them. But you know, the ultimate goal you must have is to create a heart-healthy diet which you can sustain by your own willpower and by the support of your family member. Like if you're a man, you need the support of your wife. You need the support of all those who are making food for you, so that you'll be able to get it. And that's why this book is so important. Like anyone that buys this book, like I said, it's a downloadable book, an ebook. You need to, if you're a man, discuss it with your wife. Two of you should sit down, read it through, and then look at the menu and plan how you people can bring that lifestyle change into your family, so that you can have a better lifestyle. So like I said, the first step to managing your blood pressure is to change how you eat by greatly decreasing the amount of salt in your food. That's one major thing, because a vast majority of people that eat outside the home, they can't control the salt in it. And a lot of food that you eat outside, they put a lot of Maggi and salt inside it, so you have to be very, very careful. Reduce the number of times you eat outside, so that you'll be able to control the salt level in your food. And then also you need to also stop this habit. Some people have the habit of having table salt. In fact, it's a no-go area. It's a big X, red X, table salt. Don't add salt after you finish cooking your food, then you now sprinkle salt because it's not tasty. No, you shouldn't do that. That's another major thing you should avoid. And then for lifestyle changes, you need to reduce stress. For anyone who is smoking, please stop smoking, stop drinking. Treat yourself if you're having sleep disorder. Make sure you sleep very well. There are so many other prevention and some tips in this book. Like it has about 15 tips that can help you have your blood pressure reduced. It has about up to 20 foods that can help you. And like I said, you have your menu, and then you have recipes. I have so many recipes in this book that you can have. So some common side effects of high blood pressure drugs, sometimes when you have high blood pressure, these medicines that they give you. So there are a variety of medicines that can be prescribed for high blood pressure by your doctors. Meet them, they will give you those, blood pressure medicine that you need. But why lifestyle change and food is the best thing that you need, so that these pressures will not remain high or go up for you to be on medications for a long time, is because of the side effects of these drugs. All these drugs have so many side effects that are not good, like headache, acute weakness, and then sometimes you have low potassium, dry persistent cough in some people, diarrhea, high potassium. Some people feel dizzy and they are they have nausea. All these are some of the symptoms you can have, and many other symptoms that can come from taking the drugs. So you need a good lifestyle to stay away from your drugs. Then question number 10, how do you treat high blood pressure? Like I said, prevention is better than cure. So even if your numbers are healthy, even if your numbers are okay, they have not gone up, you should take preventive measures to keep your blood pressure in the normal range, because this can help lower risk of your developing hypertension, heart disease, and stroke, and so many other of these health issues that we are talking about. So prevention is better than cure. Prevention is better than cure. Get this book, get it, and know all the things you're supposed to do so that you prevent blood pressure. And then if with age, or as you age, prevention becomes even more important for you, because the systolic pressure tends to creep up once somebody is older than 50 years old. And this systolic pressure is by far more important in predicting the risk of coronary heart disease and other conditions. Certain conditions, health conditions such as diabetes and kidney diseases may also play a role in somebody having, that is having high blood pressure. So one needs to be very, very careful. And then to talk about what to do, what are the cure, it's in this book. I'm not going to go through it today because we are just actually handling the readings. So if you're having high blood pressure and you want to know what to do about it, get this book. It will help you know what to do about it. All right. So now let's quickly look at the other end. It's not all about high blood pressure. Some people have low blood pressure. Next week, we're going to be treating low blood pressure. We're going to be taking foods that can help. We're going to be taking preventive measures that you need. We're going to be taking some tips that can help you if you have low blood pressure. We're going to be taking the foods that can help you, if you are having low blood pressure. But low blood pressure is what is called hypotension. It's called hypotension, and in adults, a blood pressure reading of about 90 to 60/60 or below is often considered as hypotension, and this can actually be very, very dangerous because the blood pressure that is too low doesn't supply your body and heart with enough oxygenated blood. And so hypotension is usually accompanied by lightheadedness or dizziness. Those are the things that you feel, when one is having hypotension, that is low blood pressure. And some potential causes of hypotension are heart problems, dehydration, some people during pregnancy, some people when they are losing blood and their blood counts are going low, some is severe infection that can cause low blood pressure, and actually for some people it's malnutrition, and also for others it can be certain medications that can cause it. All right, so next week we're going to be looking at this very well, hypertension, and like I said, all the things you need to know concerning hypertension. So thank you for joining me again. You can ask your questions and then I'll answer them now or later. And then don't forget to chat me on 0703-515-1642 if you need more questions or counseling. And make sure you get your healthy heart guidebook. If you have not gotten yours, make sure you get your healthy heart guidebook. Thank you once again for joining me today. I'm your coach, your health and wellness coach on Aging with Grace page. God bless you. Thank you. I love you all. Bye for now. See you on Thursday. Don't forget to join me on Thursday as we look at our financial health on Thursday. Thank you and bye.